No, we have the deputation at 3. So
Yep, that's okay.
if councillors could please take their seats. Good afternoon, everyone, and welcome to this Norfolk County Council Committee meeting for Tuesday, May 1st, 2018. I'd like to remind everyone that our meetings are web streamed and televised. And for those in attendance, if you could please silence your communication devices, would be great, so as not to disturb those in attendance at the meeting here.
I'm sorry.
And to avoid embarrassment. I would like to thank
Yeah,
our
I know.
camera
Don't let
volunteer,
Wendy know.
Judy Ann McCauley. Thank you, Judy
Sorry,
Ann.
Anthony, for that
Great to
one.
have you with us at so many meetings. Is there any disclosure of pecuniary interest that any councillor wishes to declare at this time? None noted, Madam Clerk. We have approval of the agenda. There are no changes to today's agenda. Can I have a mover and a seconder to approve the agenda as printed and presented? Mayor Luke moves and Councillor Oliver seconds that. Those in favor? That is carried. Thank you. And now we have some consent items here. There are 2 of them. Are there any councillors wish to withdraw any of those for further discussion? Councillor Black.
I wouldn't mind having A.
A?
Yeah.
This is the Norfolk County Heritage Committee Designation Report.
Yes.
Okay. We will move that down to item 7 then, with other reports, okay? Is that the right thing to do?
That's correct.
Okay. And what about the Friday 13th resident passes on page 21, report 18-23? That's a consent item, so I guess I'll need a mover and a seconder. Yes.
So if it's just a consent item, do we need somebody to move it and second it?
Yes.
When the time comes, I've certainly...
Well, the time has come right now.
Yeah.
Okay. So you've got the report in front of you, page 21. I need a mover and a seconder.
So
Wells
moved.
moves, seconded by Noel Height. Those in favor? That is carried.
Thank you.
Yes.
Mr. Chairman, you know what? I don't really need, this is still confusing, this consent item. I don't really have any concerns with the Norfolk Heritage Committee designation. I just wanted to speak to it, that's all.
Okay. Even if you want to speak to it or ask questions, the deputy clerk tells me that's the proper way to do it.
Okay.
So it's under item 7. It'll be the first
All right.
report. Okay. We have a presentation from Sarah Townsend with respect to Norfolk County Paramedic Services. Welcome, Sarah. You're up. Go to the podium, and you have 10 minutes for your presentation.
Thank you for having me this afternoon. I'm here to talk to you about, provide a little bit of an update for our community paramedicine program. So as you're aware, the community paramedicine program has been a pilot program started by the Ministry of Health in 2014 and has been running in Norfolk County since, with a little brief interruption for about 3 months, 1 year. We have had a temporary full-time contract in that position since its inception. And since we've started, we have many collaborative community partners among all healthcare providers, including the LHIN and CCAC, the hospital, family healthcare teams in our community, mental health agencies, and social housing with the Haldeman Norfolk Health Unit. So the funding has always been the big setback for community paramedicine. It initially started as a pilot program, and we were given funding from the ministry every year. Last year, it was also kind of a blessing in disguise that we got some extra money from the LHIN to improve the program and increase our funding overall. We have now got notification that from 2018 onwards, the ministry funding, which is a base funding 100% of $105,600, will be going to Norfolk County annually to fund the community paramedicine program, if approved tonight. The LHIN funding has also since been confirmed for an additional year of 2018-2019, which adds another approximately $40,000 onto that. So our program, as you're well aware, we've been in existence for about 4 years now, and it encompasses many different things like wellness clinics in the community housing, home visits, educational presentations, and safety in the home, things like that. And then we also do community referrals by EMS for all the paramedics in the county to refer vulnerable patients out there into the services that they need. We've taken on numerous new initiatives over the past year, including the delivery of specific education programs in chronic disease management and chronic pain management. We've actually sent our community paramedic to become a certified instructor. We've partnered with McMaster University to join the CP at Clinic program, is what they call it, which basically assists us in getting data from all the community paramedic programs in Southern Ontario and kind of making our case and proving why it's important for this program to continue. 2 additional programs that we've just recently started is a remote monitoring program, which actually allows us to place medical equipment in a patient's home. They are taught how to use it appropriately, and once or twice a day, they take their own weight, their vital signs, their heart rate, things like that, and we monitor it remotely at the office. And it includes a great program where if they take their pulse and it's outside of a range that we've given them, it alerts us. So we have the ability to call them and say, did you just walk up the stairs, or are you not feeling well, things like that, and check in with the patient remotely without seeing them face-to-face or determining whether we do need to see them face-to-face. So that's a great program that we've just started that actually is completely paid for and actually funds back into the program a stipend for every patient that's signed up for that through the program that it's providing. The Clinical Connect is just an information gathering where patients' charts are all together instead of us having a chart one where and the family doctor somewhere else. It's an opportunity for all of us to have the information together. So overall, in the just over 4 years that we've been doing this, we've done almost 3,000 patient visits across Norfolk County. And amongst those, we've delivered 6,800 assessments, and that could be disease-specific, such as heart disease, diabetes, or general health and mobility issues of how they're getting around their homes and whether they're safe or not. We've had extremely positive feedback from clients and stakeholders across the board. In the presentation, there's just a few quotes that we received on some of the caregiver surveys and the patient surveys that were sent out, just detailing how comfortable they feel being at home now that they have the support of someone coming to visit them and take care of them while they're there. Moving forward, and that'll be initiated tonight with our report, is the creation of a permanent community paramedicine program as part of Norfolk County Paramedic Services. Our intent is to ask for a permanent FTE status now that we have some more funding stability from the ministry, and hopefully to move forward and increase our programming to better serve all our vulnerable patients in the community. And that's all I have. Thank you, sir.
Thank you. Questions for Sarah? Yes, Councillor Height, then Oliver.
Thank you, Mr. Chair. Through you to Chief Townsend. It's mentioned here under interdepartmental implications that you would be recruiting for this role. So does that mean the person who's doing it now could end up not in that job?
Through you, Mr. Chair, to Council. The program will basically be posted as any paramedic position, so it'll be posted internally within the unionized paramedics. And in the collective agreement, it's all things being equal, it goes by seniority. However, clearly with additional education and things that we would look for on the resume and the job posting itself, we'll set some paramedics aside from others.
What happens to the one that's in there now as a full-time temporary?
So she accepted the contract as a full-time temporary and will go back to her paramedic role at the end if she's not selected as the permanent full-time.
Oh, so they could end up with someone else. I guess the concern there is that that person's built a relationship with these people and gone into their homes, and then it could be someone else they might not feel that comfortable with.
Through you, Mr. Chair, that is correct. The current full-time that is in there has been doing it for 2 years. When it's posted and how we divvy up those full-time hours that will be allotted may actually be between 2 people, so they'll be doing some time on the road and some time along community paramedicine to ensure the continuity of the program through vacation, sick, illness, things like that.
Okay. Now, my last question, Mr. Chair, through to the Chief, is reduction in emergency room visits at the hospital. Are there any metrics that you're able to track that dynamic?
Currently, we are attempting to track that dynamic through our own forms. So what we have is we've noticed about a 29% decrease in 911 calls among the people that we see in community paramedicine. The difficulty is with PHIPAA and the amount of information that is released. It's very difficult for us to get the stats of if they're driving themselves to the hospital or a family member is taking them to the hospital, about whether they're still visiting the emergency room without us.
Okay, but you feel there is a significant reduction?
I do feel there is a significant reduction.
Okay, thank you.
Councillor Oliver.
Thank you, Mr. Chairman. Sarah, my first question kind of is a follow-up from Councillor Heights, and that is with respect to mental health service, which our community paramedicine program provides. I understand around the chronic pain management and disease management and so on, but as I recall, we also targeted those folks that make frequent visits to the ER because of various mental health or addiction issues as well in their lives. And would you say you've seen a reduction in those kinds of visits, at least to the extent that you're able to track them? Particularly in the mental health, because with my police service board member hat on, that's a big issue, of course, is those calls going to the ER, which oftentimes require a police officer as well as all the medical personnel. So are we gaining ground there as well as the other areas that you've touched on?
Through you, Mr. Chair. It's slightly more difficult to track due to the amount of services that are provided in the community versus solely at the hospital or in an ambulance. With the new MCERT teams with the OPP and different partnerships that we have with CMHA and mental health, CAMHS. I can't get all the acronyms straight. So addictions and mental health. So we have the unique opportunity now to do some more direct referrals and get them seen in different aspects of community care, but to say that it's decreasing the amount of times they're going to emergency room, I don't know how we would correlate that at this point.
Unrelated question, Mr. Chair. I was very interested in your comment about the sort of remote monitoring and self-administered monitoring almost with some patients. How many people do you have that have signed up, if you like, to participate in that specific one?
Through you, Mr. Chair, we started the program 2 weeks ago, so I think currently there's 3 people on the roster. There is a process where we assess all the patients and determine which ones would benefit from having remote patient monitoring. So specifically, it looks at patients that have congestive heart failure, which is a fluid-based heart disease, and really benefits from being weighed every day and checking the heart rate every day. Things like that, where we can monitor and actually make a huge difference in how many times they have to go to their family doctor and how many times we can actually remotely monitor them at home in order to avoid going to the family doctor or going to emergency room by correcting them at that point. Because if we notice a dramatic change, we can do the back end, contact the doctor, their medications might change, or they might, go to the family doctor instead of going to emerge. Just provides a great avenue for us to monitor them remotely and reach out and get more people than doing 12 home visits a day. We can do 20, 25, 50 patients.
Would diabetes be another one that the technology would allow this kind of remote monitoring?
Through you, Mr. Chair, absolutely,
Yeah.
with glucometer. So diabetes, CHF, which is congestive heart failure, chronic obstructive pulmonary disease, so breathing problems, things like that, where if we give them the monitor that monitors their oxygen saturation in their blood, then we can also flow through that during the day and see when they're maybe getting an infection or a cold and their SATs are going down. We can catch that before it gets serious.
Councillor Brown.
Thank you, Mr. Chairman. Through you to Sarah. Sarah, I'm a little confused. I'm on page 28 and 29 of our agenda. And it says on page 28, 2,080 hours for paramedic, I guess, is what we're talking. 103,000 roughly, 0.5, or 103,500. Then I come over and I see 9 months at 108,600 and another 3 months at 36,000 for a total of 144,000. I guess, what does it cost to run a paramedic on this program for a year for salary? Now, it's 4 months gone already, right? So can you clarify those figures for me?
Through you, Mr. Chair, the figures that are provided by Finance, that 144,700 was the entire operational budget for community paramedicine. So that would be wages, supplies, office supplies, computer software, medical supplies, everything that they need in that program was $144,700 for the entire year. So the base wages that we got from the ministry, the base money from the ministry, is covering the FTE,
And that's
which is the 103,500
500, roughly. Yeah.
roughly.
Okay, and and even though there's 1/3 of the year gone, doesn't make any difference right now then, does it? Like if whoever takes this position, somebody new will be hired, is that what you're telling me? Or is there people that are part-time that'll possibly fill this position?
Through you, Mr. Chair, it will likely be one of our full-time paramedics, or two that split the position, half in community paramedicine, half on the road as a paramedic, and that will create one FTE for a part-time paramedic to move into permanent full-time
That's what I meant. Okay, thank you.
internally.
Thank you.
Okay, Sarah, I realize we've moved right from the presentation right to the report. Do you want to elaborate more on your report at this time, and then I'll take questions?
Sure. Through you, Mr. Mayor, Mr. Chair. So basically, what we were doing in this report is confirming that the Ministry of Health has now provided our permanent funding of 1,056 annually to our base funding completely. In addition to that, we have LIN funding for the fiscal year of 2018-2019, which may address why we're doing the 25-75 split, because we're following the ministry's fiscal year, not our fiscal year. We are asking that not only do you accept the ministry's money so that we can continue the program, but that we do create a permanent program as part of our paramedic services. This will allow us also to accept the LIN funding for this year, which is another $39,100, and we would pursue that annually on a go-forward basis, or we would have to bring that back to budget just to cover some of the supplies and things that is the shortfall over and above the wages.
Okay.
With that, I'll take any questions.
Now, questions with respect to the report? Don't see any hands up here. Okay, I have one question, Chief, and it's with respect to top of page 28. It talks about the wellness clinic is currently operated in 6 housing units. And you mentioned there Simcoe, Port Royal, Waterford, Delhi, and Port Dover. Are those private housing units, or are they Haldimand Norfolk Housing Corporation units?
All of the wellness clinics that we're running, with the exception of Indwell, are under the Haldimand Norfolk Health Unit Social Housing.
I know this subject of the paramedics comes up quite often at the housing board meetings, which I'm a member of, and they really appreciate the service that's offered there. Okay.
Thank you.
Any further questions or comments? No? I need a mover and a seconder. Peter, Councilor Black moves, and Councilor Geisens, seconder. Okay. And the recommendation reads that staff report CSD 1801, Norfolk County Community Paramedicine Program, be received as information, and that council approves the addition of 1 permanent full-time equivalent FTE to the base FTE operations of the Norfolk County Paramedic Services, commencing June 1st, 2018, to create a permanent community paramedicine program. And further, that council accept an annual service ambulance grant-based funding increase of $105,600 from the Ministry of Health and Long-Term Care to cover full financial impact of this increase in FTE for community paramedicine. And further, that council accept any financial commitment forthcoming from Hamilton Niagara Haldimand Brant Local Health Integration Network for the fiscal year 2018-2019 to offset materials, supplies, additional staffing, and training for the community paramedicine program and the new initiatives. And further, that staff be directed to continue the partnership with the Haldimand Norfolk Health Board, LIN, including requesting ongoing funding to support the program and for additional community paramedicine initiatives. And further, that the General Manager, Community Services, be permitted to execute terms on behalf of Norfolk County, including execution of any required contracts with Haldimand Norfolk Health Board, LIN, and community health care providers for the provision of funding or additional initiatives for community paramedicine in the 2018-2019 fiscal year. Any further discussion, Councilor Black?
Just that, Mr. Chairman, I'll be supporting it, and I think this is going to be the trend. We're going to have to look at ways of saving money, and I think by being proactive in such programs, we're going to decrease the number of visits to the hospital, and of course, visits to the hospital are far more costly than being proactive and intercepting them so they don't end up in the hospital through the various programs, education that this offers. And of course, this is funded by the province, and there's no net levy impact to this. So I'd support it, but I do have a small sort of administrative question, and it might be more appropriately answered by Marlene. And it's just it kind of irritates me a tiny little bit that when they refer to the LIN in the motion, there's no reference to Norfolk County, Haldeman, Niagara, Hamilton, Brant. Why isn't Norfolk in there? Like Haldeman, Norfolk used to be. Is there a reason why we're not in there? And it hasn't been in there for a while.
Yeah, so through the chair to Councillor Black, I can't answer your question specifically. I wasn't part of the creation of the naming of the LINs when they were created over a decade ago, but it is, Norfolk is not specifically included. Probably, and I'm speculating, it was Haldeman, Norfolk, so the Haldeman was taken as that region overall when they were trying to create names for the 14 LINs across the province.
Well, I know it's not the end of the world, but gee, I feel discriminated against here. Anyway, thanks.
Councillor Wells.
Thank you very much, Mr. Chair. And Mr. Chair, it will come as a great surprise, but I will be supporting this particular initiative, and certainly can see the advantages of this program and that we accept the funding. So that's the good news. But we often hear, Mr. Chair, it's free. We're getting the money from the province or we're getting the money from the feds. Today, I happen to read the newspaper, as most of you do, and realize that following the newspaper, that the province is billions of dollars in debt, that the feds are $312 billion in debt, and that we are spending over $1 billion a month on interest payments alone. That's $1 billion a month on interest payments alone. And yet we keep saying these things are free. Well, Mr. Chair, somewhere along the way, this freebie has to end. And as long as we continue to accept that mindset that we can continue to add and that somebody else is paying, that somebody else, Mr. Chair, is us. It either comes out of your pockets at one level or the other, but one thing I know, and that's what this gray hair says, it is not free.
Understood. Any, Councillor Sonoman?
Thank you, Mr. Chair.
Looks like you ran out of energy there.
There we go.
There it is.
Thank you, Mr. Chair. I'll be supporting this. To me, the health of our citizens is paramount. More important than hubs, dams, or overhead wires. I've been to the emergency room lately at the Simcoe General Hospital or Norfolk General Hospital, I should say, and the waits there can be horrendous. If this does even a small percentage of decreasing our waiting times there in the hospital, it's worthwhile. Thank you. I'll be supporting it.
Right. Anything further? No? Okay, there is a mover. Councillor Black moves and Councillor Geisen seconded. I read the recommendation. I'm not going to read it again because it's very wordy and cumbersome. So those in favor, that is carried unanimously. Thank you, Sarah, and good luck with the program. We are now moving to deputations. Our first deputation is by Paula Johnson, and it's with respect to a sewage connection. And Ms. Johnson, if you could take the podium there, you've got 10 minutes.
Anyone?
You got some paperwork? Okay. Sewage connection.
Yep. I didn't know how many to bring. I quickly. Are we ready?
Okay, I give you 10 minutes starting now.
My name is Paula Johnson. I'm here to put in a request to have my home hooked up to city sewers. My house is 12 3rd Ave, Simcoe. Since 2016, I've been requesting to be hooked up to the city line, starting with phone calls. I contacted the city when I saw the construction sign go up in January. I was then informed that I was to put in a request to the city. Since then, I've been on the phone with various people, various departments. Peter Black, who CC'd Bob Fields, who CC'd Lee Robinson, who CC'd Kathy LaPlante, who contacted me regarding my septic tank. As it stands, I'm hooked to a septic tank. It costs me $170 every 3 weeks. That is with no laundry, and we just conserve a lot of water. I have 3 kids. It's unrealistic my septic tank bill will remain this low as my children grow older. To further dismay, I'm a single mom. I was informed that my septic rates would increase between 300 and 500% in 2016. They have went up $70 in 1 year. Right now, 2nd Ave is under construction. It's about 100 yards from my house. All the septic lines are being redone. We don't have septic lines from the original construction. On top of this septic construction, last week, it broke and our water lines were full of septic. Not good with 3 kids for a week. So this construction is 2 years. The soon-to-be substantial increase in septic bills, unnecessary hardship, it's already caused my family. I implore this council to please approve my request to have my street hooked up. Even though Bob Fields said I'm not part of the 10-year plan. Actually, Upper Wellington is not part of the 10-year plan, but it is under construction right now. I'm on the corner of 3rd and Upper Wellington. So I'm right behind Shoppers Drug Mart, kind of, and we're on holding tanks, and it stinks. The neighbors stink. There's 4 houses, and that's about it. That's my case.
Okay, thank you. And you're...
I have all kinds of emails in there,
Yeah,
back and forth.
I'm just following here. You mentioned in your letter here a septic tank, but it's actually a holding...
It's a holding tank.
Holding tank, okay.
Yeah, so...
Very good. So you ready for questions?
Yep.
Okay. Questions from committee? Yes, Mayor Luke?
Thank you very much, Mr. Chair. And Paula, thank you for your deputation. If I heard you correctly, you're saying that you're paying for your tank to be cleaned or pumped out $170 every 3 weeks?
Mm-hmm.
So you're paying almost $3,000 a year to empty a tank.
Yes.
Over
And it's going up
$2,500
and up. It was
Oh, yeah.
supposed to go up, but they're slowly increasing it. so.
Slowly. You're too polite, thank you.
And I've called every septic pump in the whole nation, and that's the cheapest rate.
Further questions to the deputation? Yes, Councilor Black?
Paula, I think you're right on the corner there, but there's a number of other houses.
There's 4
Yeah,
houses,
and every one of them is on a holding tank, I believe.
as far as
Are
I
they
know,
not?
and Brody Mechanical.
Yeah, you're on municipal water, but just on all
A
those
holding
properties
tank.
on a holding tank.
Yeah.
Okay, thanks.
I tried for a septic field, but it's Long Point Conservation behind us, so we don't have room for one anyways. It's a watershed, right?
Councilor Oliver?
Thank you, Mr. Chair. On that last point first, have you actually spoken to LPRCA to see if you could get a permit to create a septic tank and tile bed?
I had a couple guys come in and they said there's not enough room because it's sloping backyards.
So it
right
would require
into
some
the-
fill in order to,
There's not enough room, they said.
and who's they? Were
I
they
just called-
LPRCA people, you mean, or?
No, I called a few septic field installation guys to come and do a quote, and they said there's not enough room.
Okay, well,
And I have
regardless
the
of what
biggest
they
lot.
might tell you, I would encourage you to contact LPRCA. I'm sure they would be willing to come out and have a look at your problem and at least give you their advice. My other question, though, relates to Councillor Black's question of you, and you said there are 3 other neighbors besides yourself on 3rd Third Ave. Are they also interested in being connected to our municipal sewers, should we come down to you?
I could go and ask them. I just got this appointment a week ago.
Yeah,
I-
okay, well,
I'm-
that also would be something
I
I
just
would
figured because
encourage you to
I'm
do.
actually right on the corner of Upper Wellington that is under construction. I
Yes.
could just go through the side of my yard. And
I think
they
it would add credibility to your request if other neighbors were also interested, so I would encourage you to do that if you haven't. Thank you.
Counselor Height, did I see your hand up?
Yeah, Councillor Oliver just asked my question, but just to verify, you're over by the Shoppers Drug Mart, right?
By where the dog park is, that's Second Ave. It's 2 streets behind Shoppers Drug Mart.
Okay. Thank you.
Yeah, it used to be a pond, but it's a creek now.
Counselor Bratton?
A little confused. You say you have municipal water?
Yes.
And maybe it's not a fair question to you. Is there a sanitary sewer on the street?
No, they're upgrading them right now on Second Ave and Upper Wellington.
Yeah, so there was never a sanitary
No.
sewer on Third Ave?
No. There's a
Okay.
storm drain, I think, that's it.
Okay, I'd like to ask Lee a question.
I think it was just forgotten.
Thank you.
Okay, where do you want to go with this? No more questions for the deputation? Counselor Oliver?
I'll move we receive the deputation as information.
Okay, seconded by Mayor Luke. Those in favor? That's carried. You may be seated. Thank you very much.
Thank you.
And now we'll go to Counselor Black.
Mr. Chairman, I think we do need some more information from staff. I don't know if here's the appropriate time, but certainly be interested to know, now that we are doing some work on Second Ave, if it is possible to come down to Third Ave. Now, I don't know if a question through you to staff now or a report. I don't know.
I can see
I'll
that,
ask Lee now.
Ms.
then.
Robinson's prepared to answer your question.
What her thoughts are on this.
Through the chairman to council, I can certainly do preliminary information this evening, and if council wishes, we can get into a more detailed report. The deputation is correct. There is no sanitary sewer on 3rd Avenue, nor is there a sanitary sewer on Upper Wellington. In order to service that area, it would require the installation of a sanitary sewer on 3rd as well as Upper Wellington and a sewage pumping station. Because of the way the reason that there was never sanitary services put in that area is because of the grade. We can't get it to flow by gravity. It's not possible. So there's a couple of different options that have been entertained in other places in our municipality. The homeowner puts in basically a private force main on our road that would take it up to, they put in a grinder pump in their basement, and then they run a private force main up to that. That's the reason there are no sanitary sewers, is it cannot flow by gravity. When we did the design work for Second Ave, et cetera, we actually looked to see if we could drop sewers, et cetera, to be able to service the area. It's not possible without some sort of a lift station, be a sewage pumping station or grinder pumps in their basements to do that, both of which are of substantial cost. To service it. That's why there is no servicing in that area. If council would like more detailed information, we were certainly happy to provide that. With respect to the septic systems on their lots, from our review, the lots are very, very small, and as such, there is not sufficient room to actually install a septic system. They would be into almost a mini treatment plant on each lot in order to meet the requirements of the environmental as a result of that. So they really are in an unfortunate situation in terms of their lot size and the inability to connect to a municipal sewer because there isn't a municipal sewer. Upper Wellington is being reconstructed, but we're not doing underground works, we're just doing the surface works with respect to that.
Councilor Black, go ahead.
Mr. Chairman, I certainly wouldn't mind seeing something in writing. You know, not looking for a huge report or anything, but just maybe some numbers on, I know Lee said it would be very costly, but just to see what that would be, or even how much it might cost to put a private setup there for the individuals to have to pump up. I know she said it was costly, but if there could be some sort of number in there, I wouldn't mind seeing it. I would imagine that everybody else wouldn't mind seeing it.
Okay. Perhaps we can get direction, but I'm going to go to Councilor Brunton first.
Thank you, Mr. Chairman. Through you to Lee. Lee, you said that, I apologize, I forget the streets. Wellington, towards Third Ave is being reconstructed?
Through the chairman to council, yes, Upper Wellington, a small portion of the work on Upper Wellington is being done from Second Ave south to Third.
Okay,
But it's
and
just the resurfacing of the road. It's not, we're not
shave and pave it?
a little bit beyond that, but we're not doing any kind of depth work
Okay.
because
Question,
there's no sanitary sewers.
right, like you talked about a force main, can we, is it possible, like if you said there's 4 houses and if we put a small force main in the boulevard area, I'm sure there'd probably be room. Is that, if you did a report, could you look at that?
Through the chairman to council, if we put a force main in, we need a pumping station to pump through the force main.
Can't have, just the grinder pumps won't work for,
They would each require their own, they have to have care and control of their own sewage.
yeah.
So they would each need to basically put a small force main in for each one of those houses.
We couldn't, what I'm getting at is we couldn't have them all pump into one force main.
We cannot.
Okay.
Not without a sewage pumping station, because it just backs up in the force main. When one turns off and the other one, it's a hydrostatic nightmare.
Have the, and you say there's 4 properties, but this lady could do her own. But the other 3 haven't really came forward to ask for any help. Am I right?
Through the chairman to council, we have not been approached by any of the other property owners in that area to do something like put in their own grinder pump with their own force main. We've certainly encountered this in other places and certainly have permitted people to install grinder pumps and their own force mains in the right-of-way to allow them to get relief from this type of a situation for a variety of reasons, septic system failures, small lots, whatever the case may be.
Well, I understand to put in a sewer and a pumping station, we're talking quite a bit of money. So I'm wondering, could you do a report like I know there's different force mains around town, and if we could do that, maybe solve this lady's problem. Would a report be in order for that then?
Through the chairman to council, sorry, I'm not, if council would like to provide staff with direction, we can certainly provide a report for a variety of different ways that the property could be serviced for council to consider, and we would include all of the, I'm going to say, affordable options.
Okay.
I can think of ones that would cost millions, but I'm sure that the homeowner is not interested in entertaining those either, so within the reasonable options, we can absolutely provide that.
Okay, but if she, just so I'm clear, if she was willing to pay for, say, a 2-inch force main, I don't know where the closest manhole is up there, but probably, you say at the corner of 2nd Ave and Wellington, I guess, eh? That's probably where the closest would be?
Through the chairman to council, she would need to pump, give or take, about 130 meters from her property up to the closest connection point.
Okay.
Which would be on 2nd Ave.
But that's, okay, no,
Which is totally possible based, like, with the technology that's out there today.
yeah.
But like everything else, it's not super cheap.
No, I realize that, but Mr. Chairman, I think that's a good idea to put a report together for staff, just to maybe help this lady out. Thank you.
Okay, I think going to need some direction and a show of hands that a report be put together providing some affordable options. Okay, those in favor of that direction? Carried. Thank you. Moved by Councillor Black, seconded by Councillor Brunton. Okay, for the direction. Okay, just confirming that. Okay, thank you. Hopefully we'll get somewhat of a solution. Thank you very much for coming forward. And now we'll move on to our next deputation, and that is from Megan Allen, Lindale Heights Parent Council Representative. If you could take the podium. And this is with respect to the deputation, the Rutherford sidewalk request. Okay? And I don't know who your friend is with you, but if you could share the name, that would be great.
Hi, I'm Vicki Trowbridge, and I'm...
Trowbridge?
Trowbridge.
How do you spell that?
T-R-O-W, Bridge.
Okay. Good. And you're sharing the deputation, are you?
Yes, I'm also on Parent Council.
Okay, so you have 10 minutes? I'll
All
let
right.
you know when 1 minute's left, okay?
Thank you. Thanks for letting us come in today. As you know, my name is Megan Allen. This is Vicki Trowbridge. We are here on behalf of Lindale Heights Parent Council, as well as Elgin Avenue Public School Parent Council. I'd also like to state that we're here as parents, moms, and we feel it's our responsibility as parents, as a community, and as council to keep the children in this community safe. And we also feel it's our job to advocate for those kids because they're just too young to understand what's happening and what's going on.
Microphone, please?
Sorry. Children are just too young to understand what's going on. I have a 4- and a 6-year-old at home. Ben's more interested in what character of gummies are going to be in his lunchbox. He doesn't understand the idea of the safety of the sidewalks. So we're here today to request that there is a sidewalk be placed on Rutherford Drive. You will see on page 2 in your little pamphlet where the Rutherford Drive is and where the sidewalk would stop. We are extremely careful with this because we have contacted most of the residents on Rutherford Drive, and they are on an understanding that we are requesting that the sidewalk only go to the fence line, which is Grand Erie District School Board property, like where the fence line ends. So the reason for the sidewalk to go in is obviously a safety issue. We want to increase the functionality and solve safety concerns for our students who walk to school. Our parking lot is a madhouse at pickup and drop-off. You wouldn't need to be there very long to find that out. And Rutherford Drive is also slightly a madhouse at pickup and drop-off. So we feel that the sidewalk is essential for parents and kids to be able to get out of their vehicle and safely access the school property. So in the winter months, this will allow our children to also have access to the sidewalk so that the snowplows are not leaving large piles and having children climb them and slide into the street to our parked cars or distracted drivers. We feel that having the sidewalk would decrease the foot traffic that's on Donnelly because children currently don't have a sidewalk to access Rutherford. We all walk through the Donnelly sidewalk and then walk through the madhouse of our parking lot and enter our school property. So this sidewalk can also be used by the community, not just our children, but other children that are in our community that may not attend Lindale School or just come to visit. They can ride their bikes and feel safe close to the school property. So I'm going to leave it to Vicki now to discuss our research and what we've done in regards to putting in the sidewalk. So Megan and I went door to door on Sunday to all of the people who live on Rutherford Drive, just to let them know what we were doing and why we were coming, and that we didn't want to go through their yard. We're not trying to take away their front yardway. We just want to keep the children safe. This is also the second time this has been brought up. Our previous principal, Dennis Wright, went to the city and asked for this sidewalk also, and he was told that when this road came under review again, that it would be considered. And the trees would have to come down on that boulevard there to have the sidewalk put in, and we are more than willing to replace the trees on our side of the fence, put them on our side of the fence on the schoolyard, and we would be more than happy to put trees and replace them. So as you see in your pamphlet, I think the last page, this is a petition that was sent home to our parents. And we had a fairly good response. We do have 407 students in our school right now. We will have 650 next year with Elgin joining us. So respectfully, we understand that maybe it might not be based on the students that are in our school. So we are making sure you understand that this is not just based on the number, it's based on safety for our kids as well. So anyway, so the petition did go home, and we got 122 come back to us. So that's 122 families. So knowing that the children in our school may be siblings, so we have a youngest and only list of approximately 225. So 122 of those did come back. So, and we also, when we were on Rutherford Drive, not a lot of people were home on a sunny Sunday afternoon, but we did get a chance to talk to quite a few of the people on the street and had, I think, 8 to 10 signatures on a separate petition for Rutherford, as long as they were under the understanding it would not go past the fence. So
Okay.
all in all, that's what we're requesting.
You ready for questions?
Sure.
Okay, Mayor Luke?
Thank you very much, Mr. Chair. Sorry, Vicki and Megan, thank you for being here. I'm looking at the map, Mr. Chair, on page 2. I have a couple of questions. Just because some of our councilors are not familiar with road names, it's my understanding, looking at this map, that Rutherford is on the east side, which is the left of the page that runs to the back of the school property. The first street going north on Rutherford to the right, I believe, is Johnson Street, and the second street further up would be Jones. And through the chair to you, I believe that you're requesting a sidewalk from the corner of Rutherford and,
Anderson?
sorry?
Anderson?
Yes, sorry,
Yeah.
yeah, I get the names confused
Yeah,
up there
that's
as well. So you're really looking at the southeast corner, top of that map, Mr. Chair, that's circled in red, which is Anderson, that runs along the south side, going back up to Donley, and all the way up to Jones.
Past Jones.
Just
Past-
past Jones. There's
Past
a,
Jones.
yeah, there's a fence line right where the end of that little red circle is. And then that
Okay.
house right next to it is private property.
Okay, I got it, yes, yeah, pardon me, just up north of Jones, thank you. So my questions are, I was out and drove it, of course, the school was in at the time, they weren't walking to and from, or the buses weren't there. What's your estimate, through the chair, what's your estimate of the length of sidewalk required, any idea? It's quite
Unfortunately, we
a
didn't-
stretch,
It is quite a stretch. It can
And-
be, yes.
so I know it's quite a distance there, and I really don't know, I should have estimated I did. And the second question I have, Mr. Chair, through to the deputation, it's my understanding with the closing of Elgin for 1 year, starting in September, there will be shuttle buses from Elgin to Lindale Heights. A bus will make 2 shuttle runs in the morning. I don't know how many, but I'm told there'll be 2 shuttles per bus, correct?
They're currently in the works. There's either going to be 2 buses or 4 buses. So there'll be 2 buses that run 2 routes
Yes.
to take the kids, or there will be 4 buses running once to take the kids.
Yeah, I was told 2 shuttles, but it doesn't matter, as long as they get there,
Yeah.
whether it's 2 buses or 4. I'm told that you're going to have an enrollment through the chair of over 750, around 750 students for the 1 year?
Yeah, yeah.
Okay. The question I'm leading to is this. Would it be fair to say, Mr. Chair, through the deputation, that the primary reason, and I'm certainly aware of where that walkway is and what happens there with the traffic, I have been there when the traffic is there to pick up kids at the end of school, dropped off in the morning. Is it fair to say through the chair that the main concern is the loading and unloading of students when everybody comes to school to get there at a rush at the same time, more so than the sidewalk further to the north, up along the park? I want your comments through the chair, if I may, on that aspect.
Being a parent who picks up on Rutherford Drive, parents start lining up in their cars at about 2:30. And it goes all the way down the road and to pick up their children. And we have walkers who walk through all those parked cars. And even if there's buses bringing the majority of the Elgin students over to Lindale Heights, there's still going to be people who drive their kids that are dropping off. And people double park and drop off. And we had the one side of the road marked so they couldn't stop on that side of the road. And we had the speed limit brought down to 40. So it wasn't so crazy. And we moved the one bus that was flying through there. It is crazy. There is a huge safety factor for the kids. They need somewhere to walk when they're coming up Jones, coming Anderson, to get to the school safely on that side.
Mr. Chair, I have one more question, and I want to assure our deputation here, these 2 ladies, that I certainly am well aware of what happens at school time, and some of the situations, Mr. Chair, at schools where kids are around, buses with tires this high, with slippery curves and snow piled on, I know all about that, and so I'm on your side here. The other question I want to propose is this. The school board has approached us some time ago to look at nutrition break outdoors using the neighborhood park, and of course, we agreed to that, absolutely. The children playing in a fenced-in park is a pretty good thing to have. Would it be any benefit, and I'm thinking of cost-wise here, notwithstanding that maybe some sort of lesser degree of sidewalk around that walkway, would it be maybe cheaper and safer to bring the buses into a turnaround on the parkland on the along Rutherford there for the 1 year and then one, or is this really something that should go beyond just this year? Your thoughts on that? I want the kids to be dropped off in a safe area and picked up. Thoughts?
I think this goes beyond our 1 year Elgin coming to our school. This is an ongoing issue every year. This isn't just because Elgin's coming. And when our buses are dropped off on, in the parking lot by Anderson there. They pull in off of Anderson and the buses are dropped off there.
And that's only a bus zone. Like parents
Yes.
don't go in and out of there with their cars. It's staff parking only. The buses, you can see it on your map there, the buses will come in and then that's it. So I don't know what Grand Erie District School Board has in mind in regards to dropping off those 2 or 4 buses for Elgin. We just know as parent council, we want to represent our kids and their safety on Rutherford.
So, Mr. Chair, my apologies for speaking so much. My very last question at this point will be, this sidewalk request is really not necessarily about buses loading and unloading kids. It's about the amount of kids that come out the east side of that school property and a place for them to stand, walk, while the cars are parked
Yes.
safely.
And
correct?
keeping in mind that just
Okay.
because the children exit the east side of the property, doesn't mean the kindergarten kids aren't walking to meet their siblings to exit the east side. It's more than just that area.
Thank you kindly. Thank you, Mr. Chair.
Okay, thank you, Mayor. Going to Councillor Height.
Thank you, Mr. Chair. Through you to the deputation. You mentioned you're on the council. Have you approached the Grand Erie School Board and asked if they have any plans to upgrade their traffic and drop-off area?
All we know is what we know through parent council itself. When Bill, our principal, represents Grand Erie District School Board, he lets us know whatever is happening with transition committee with Elgin or anything in that regards. So unfortunately, we wouldn't know that information. All we know is what we know as parents for the safety of the kids.
Have you spoke to any of the trustees?
Well, all we know is what the bus situation is, was the 2 or the 4.
Okay.
So no, we haven't reached out that far in regards to this exact sidewalk.
Okay, thank you for that. I guess my concern with the sidewalk coming down the side is you're still going to have cars piled up there. It would almost be better if they could move over into a lane and have a pickup and drop off lane as opposed to the sidewalk, and we would have to address that. And I'm assuming it's their property, so they would have to be involved in it. I don't know that a sidewalk is going to solve your problem here. It's going to just make it similar to the north side, Rutherford, I guess it is. Would it not? Wouldn't that be better to have a spot you could drive in?
Probably having the increase of traffic that way, the flow of traffic that way. I still don't think that taking a sidewalk off the table is like a safer option.
Right.
And that's mainly due to like the snow removal and those types of things. Those kids have to climb up and over. Whereas even if you had a drive-through and half a sidewalk or whatever it is,